Let's talk about breathing. So you inhale first, and then when you inhale, you take in oxygen, goes to your lungs, and then you exhale carbon dioxide. And then when you inhale, it depends on the FiO2. So in room air, FiO2 is 21%, and what you inhale is called the partial pressure of inspired oxygen. And how do we get this? So we get this by multiplying the atmospheric pressure, which is 760, times the FiO2, which is 21%, equals 150. So this is the partial pressure of inspired air that you inhale. It goes to your lungs. However, when it reaches your lungs is wet, so you need, and this 760 is actually in sea level. So when you reach the lungs, when you reach the lungs is wet. So how much partial pressure does it have in the lungs? So PaO2 is about 105, because what you do is PI, partial pressure of inspired oxygen, you basically minus the water vapor to get this partial pressure of oxygen of 105. So once it reaches your lungs, it goes to the arteries. So in your arteries, the oxygen goes from the alveoli to the arterial blood. So arterial blood, and it has a P small letter A for artery, O2 of about 100. And then after that, some actually adheres to with the hemoglobin. So SpO2 or SaO2 with 99% SaO2. This is a hemoglobin. And when the oxygen is adhered to the hemoglobin plus oxygen, so this is actually called OxyHemoglobin. And then it goes to the tissues, and then it now offloads your oxygen. So, and then from the tissue, it unload or offload, CO2, they're the same, offload and unload. And then it now loads up or picks up carbon dioxide, the blood picks up carbon dioxide, and now it's called carbaminohemoglobin. And this is the hemoglobin plus CO2. And this is like, the affinity between oxygen and the hemoglobin affinity between this is called Bohr effect. And in Bohr effect, when there is more oxygen than the CO2, if there's an environment with more oxygen, then the hemoglobin is more likely to pick up oxygen. And then, so that's what happens in the lungs. However, in the tissue, when there's less oxygen in the system or in the area, then the Bohr effect states that the affinity of hemoglobin for oxygen diminishes. So now it offloads or gives away the oxygen it's holding on to for the tissues to use. So that's the Bohr effect. And then for the Haldane effect is for the affinity of CO2. So like oxygen, if there is a high concentration of CO2 like in the tissues, then the hemoglobin would more likely have more affinity with CO2, so pick up CO2. And then once it reaches the lungs, where there's less CO2, then the Haldane effect states that the affinity of oxygen with CO2 is less, so it will offload the CO2 in the lungs. So there you go. And then so now going back where we are exhaling now, so the CO2 is with the hemoglobin. It's called carbaminohemoglobin, and do not mistake this with carboxyhemoglobin. Writing down carboxyhemoglobin, because carboxyhemoglobin is actually hemoglobin plus carbon monoxide, and this is toxic. So do not mistake carbaminohemoglobin, or do not call carbaminohemoglobin carboxyhemoglobin, because it's not the same. So so hemoglobin H, which is carbaminohemoglobin, goes to the venous blood, and there's a partial pressure for this, and it's partial pressure of venous blood oxygen. So this is roughly around 40 millimeter of mercury. And then now we're gonna go back to the lungs and exhale. So you will see Haldane effect here and another here. And then you will also see the Bohr effect here, and so over here too in the lungs. Okay, so moving on, we are going to think about oxygen dissociation curve, and a lot of people gets really confused with this. Okay, so this is oxygen dissociation curve. So this kind of looks like a letter S, but this spot here is the SpO2 or O2 concentration, and this spot here is the pressure of oxygen. So this part in the graph that I colored green, this happens in the lungs, and this part that I'm coloring red happens in the tissues. So what do I mean? So in here, in this spot where the green is, you will see that the SpO2 is high and the pressure is in the lower side, right? Here's the pressure. I mean, it's high too. So the SpO2 is high, and it's because, and then this spot right here on the red, it's low oxygen. So you will see that Boyle's law states that when there is a high pressure, which is here, there's low volume. So pressure and volume are inversely proportional. So you see this is the lungs, and although this is partial pressure, so the concentration here is high, and the volume here, well, this is not the Boyle's law thing, but you can relate it to that. But the O2 dissociation curves is going to tell you about the affinity of oxygen with the hemoglobin. So this one spot is, you see how if the curve shifts to the right, you see that the CO2 went down, and that is because it means that the hemoglobin is actually offloading oxygen to tissues. And this is shift to the right. And then if this thing shifts to the left, which as in this new graph is going up, so this spot went up. See how the highest thing, oxygen, went up here? So it means that the hemoglobin held on to oxygen. So hemoglobin love oxygen, and this is the left shift. So it means that the hemoglobin did not release oxygen to the tissue. So that's bad, because now your tissues are not going to get it's not going to get the oxygen that it needs. However, oxygen dissociation curve can happen at the same time in a body. Like if you are, example, working out one of your extremities, like you're doing perhaps you're doing a bicep workout on your right side of your arm, and then this one has weights, and this one is just resting. Of course, there's more blood that's gonna go to this extremity on the right, so you will see that the hemoglobin is offloading more oxygen in this spot, whereas this spot on the left arm, since it's just resting, the hemoglobin may be holding on to oxygen on this blue spot where the arm or the extremity is just resting. So you can see these both phenomena at the same time. Another point is hemoglobin dissociation curve. The right shift has this causes of right shift, have causes, right? So one is acidosis. I actually have a mnemonic here, HAT, and all of them are going up. So HAT stands for hydrogen ion or decrease in pH, acidosis. Second one is altitude. Increase in altitude would offload more oxygen to the tissues, and temperature. Increase in temperature would shift the oxyhemoglobin curve to the right, which would offload more oxygen to the tissues, and so is increasing to 3 dpg. And then the other one, on the flip side, on the hemoglobin holding on to oxygen, there are also, with a HAT mnemonic that I have for the causes, HAT, 3 dpg, also hemoglobin F, and methemoglobin. Methemoglobin. So these are going down. All of them are going down. And then presence of hemoglobin F and presence of methemoglobin. So HAT is hydrogen ions, which is increasing pH, which is alkalosis. And then altitude, low altitude, the hemoglobin holds on to oxygen, and temperature, low temperature, hemoglobin holds on to oxygen. So also it's important to point out that the Haldane effect can also be seen here. The Haldane and the Bohr effect. So the Bohr effect, you see it on here too, where in the lungs, like I said earlier, the oxygen is more have more affinity with hemoglobin in the lungs, but in the tissues, the oxygen have less affinity with hemoglobin. And then, in contrast, we're going to talk about the Haldane effect. So the Haldane effect is in the lungs and in the tissues are the same, but in the lungs, the Haldane effect talks about the CO2 affinity with hemoglobin. So in the lungs, the CO2 have less affinity with hemoglobin. So now the hemoglobin would offload the CO2. And then in the tissues, the CO2 have increased affinity with hemoglobin. So that's how the hemoglobin picks up CO2 from the tissues in order for us to exhale it back to the lungs. Sorry guys for the noise earlier. It's from my little toddler. Studying with my toddler, and sometimes it just does that. I hope that this will not prevent you from subscribing and supporting us in my channel. Have a good day. Bye.